The results of a new survey show just how many American lives are touched by gun violence. The study was done by research group KFF. And joining me now from that organization is Ashley Kurzinger. Ashley, welcome.
Thank you so much for having me.
So let's start with the basics here. Where and how was the survey conducted, and what was the overall goal? What were you exactly trying to learn?
Yeah, so it's a nationally representative survey set to better understand how prevalent incidences of gun violence are in this country. It's one of the most in-depth surveys measuring all different types of experiences with gun-related incidents. And we found about 1 in 5 adults say that they've personally been threatened with a gun. 1 in 5 adults say they've personally witnessed a shooting. And one of the more striking findings was 1 in 5 adults have actually had a family member who's been killed by a gun or with a gun, including suicide. Overall, that leads us to more than half of US adults say they or a family member have experienced a gun related incident.
1 in 5. So that was really the crux of what you learned here. How much of a surprise was it, or were you expecting that that would fall in line with the expectations?
Since it's one of the first surveys to measure all of these different types of gun related incidents, we weren't exactly sure how prevalent it was. But when we ran these numbers by public health experts and those that are studying firearm injury, they say they really hold up. These experiences, as you can imagine, are more common among certain populations. For example, 1 in 3 Black adults in the US have had a family member killed by a gun.
Okay, so let's break it down here. What are the differences between ethnic backgrounds, urban, more suburban, rural communities? Did it really get into, the geography and background of the respondents?
Exactly. Because it's a nationally representative survey, we can look at these different groups. So we can look at the prevalence among Black and Hispanic adults and white adults. We can also look at urbanicity, so those that living in urban areas versus rural. And interestingly, though, even though a higher share of those living in rural areas say that they have a gun in their home or they own a gun, they are just as likely, or not more likely, as those living in urban and suburban areas to experience one of these gun related incidents. It's more than half of adults, regardless of where they live in this country, that have experienced this. One of the other things that we really were interested in studying is how these experiences impact people's daily lives. And what we found is that, especially those that have had these types of exposures, they're really worried, and more than half say that the threat of gun violence is a constant worry to them and their families.
So you mentioned this briefly that you asked respondents about gun possession themselves, and you really delved into ammunition as well. And is the gun stored in a safe place? Can you talk about that part of what you found out?
Absolutely. So 4 in 10 adults live in a household with a gun. And so among those, 75% have either said that they stored their gun loaded, unlocked, or in the same place as ammunition. And we think that this is one of those opportunities for public health experts and those doctors and healthcare providers to have conversations with gun owners about safely storing their guns. For example, very few people in our survey said that they had a conversation with their doctor or their pediatrician about gun storage or gun safety in their home.
Okay.
And so we know.
I'm sorry. I get where that is going, but can you talk to me about the overall where we go from here? What do you do with this information? How do you use that to sort of enact or ask for changes?
Absolutely. Well, we know that doctors and healthcare providers are the most trusted sources of information in this country. So this just shows one of the opportunities where people could start having conversations about guns in the home and gun storage. And so we think, the purpose of this study was really to identify prevalence. And so we're hoping that this, once we have these numbers, we can really look at how it's impacting daily life in America.
Sounds like a very comprehensive survey. Ashley Kurzinger, thanks for joining us and thanks for your time tonight.